Okay, I've started recording. Well, welcome everybody. Thank you for joining us online. Appreciate you being with us and being adaptive to holding the meeting in some new space rather than meeting in person. I know it's a little bit harder to do this online, but I really appreciate that. What the coalition has been doing is gathering in different locations across the state. We held a meeting in the metropolitan region earlier this week. And then we held a meeting up in Duluth earlier this week, and then we were going to physically be with you down in Mankato, and then change that to an online meeting. And then we held a meeting on December 11th, webinar with the 6 priority evidence-based targeted home visiting programs that have been outlined in the RFP. So I just wanted to make sure you knew about those. Our whole reason for doing these, or the purpose for doing these meetings, is to really help prepare the field to put forward some really strong proposals. And then because it's the first time that the Minnesota Department of Health has had the opportunity to contract directly or grant directly to nonprofits for home visiting services, we really wanted to help prepare our nonprofit partners and then our public partners who are looking to the nonprofit community to partner in different ways or think more collaboratively across different public systems. So that's our purpose for the coalition. So I forwarded you some of the materials that we've been sharing with people, and they are about the coalition, who we are, and how to get engaged if you haven't been actively engaged already. So we welcome people to join. There is no membership fee. It really is a network, a coalition for people to network and work on practice issues together. So we welcome you to join us. And then the other handout I gave you about the coalition is some of our training materials. And that I just wanted to make sure people were aware that we, over the last several years, have been providing opportunities to free training. Whenever possible, we record them and upload them to our website as podcasts, and that you can use these and download them at any point in time. Many organizations have used them for training purposes with new staff and or current staff to give people some flexibility to engage in training when it makes sense for them. So that's a little bit about us. It sounds like somebody else may have joined us. No? Okay. I don't see anyone else. Okay. So let's see here. What I wanted to do this morning is, before we turn to the requests, I'll go back, is to actually take some time and introduce ourselves to one another. So what I will stop sharing my screen, and then we'll have an opportunity to hear from each of you and meet each of you, so that you can introduce yourselves. So if you could start out by sharing who you are, what organization you work for, and then we're interested in sharing which types of home visiting programs you're currently running and operating, whether or not they are evidence-based or evidence-informed programs, and then your primary target, your target population, and then the region. So it's name, it's organization, who you are currently serving, who's your target population, and within what region. And then if you are running an evidence-based program, which one? And if it's evidence-informed, you can let us know that. I know many of you down in your region are using an evidence-based curriculum, Growing Great Kids, so that would also be helpful to know if that is what you're using, even if it's not a program itself. So who would like to start? Would you like me to call on each of you, or would you like to take turns? Because it is set up as a meeting, so we really do want to make this as interactive as possible.
This is Shara. I can start.
Thank you.
My name is Shara Sevchek. I'm the Public Health Director in Faribault and Martin counties. So our organization is Human Services in Faribault-Martin. We are currently affiliated with Healthy Families America and run a very robust Healthy Families America program. We do use Growing Great Kids as the curriculum with that model. Did I miss anything?
Your target population.
Oh, target population. We are currently recruiting or identifying participants through our WIC program. So I would say our target population is prenatal and obviously lower income as well.
Mm-hmm. And you said HFA, right?
Yep.
Okay.
HFA.
I'm sorry, you probably said Healthy Families America in case everybody does not know what HFA is. Okay. Yes. All right, great. Thank you.
Yep.
All right, who would like to go next?
I can go.
Mary. Oh, okay, go ahead.
This is Erin. I am actually self-employed in a grant contractor with the YWCA Mankato, and I live in Rochester right now, and I'm going to grad school, but I still do some grant research and things for them. And so, and I used to work actually for the YWCA there, and was one of the initial people that worked on our Ready to Learn program, which is our early childhood education program. And it's specifically focused on immigrant and refugee families, and it does utilize Growing Great Kids.
Okay. Great.
And it looks like I'm the only one left. This is Mary Hildebrandt from Nicollet County Public Health. And our target population is we offer universal home visiting to all new moms. We also do need-based prenatal and any follow-up with any parenting issues or with a more family home visiting, as needed.
Mm-hmm.
So
Great.
we're evidence informed.
You're running all informed, Mary, you said?
Yeah, we use a curriculum from Florida State.
Okay.
And I believe it's evidence informed.
All right. All right. And is it the curriculum that you're using from Florida State, or is it the program? So are you using Growing Great Kids within this program?
No, we're not using Growing Great Kids.
Oh, okay. Okay, perfect.
Mm-hmm.
All right. Okay, it looks like we lost Amy, but Erin, I know you're representing the YWCA in Mankato.
Correct. I don't know why. I don't know where she went. I did reach out to her, but she might have got pulled away.
She might have. She was on earlier. She was going to leave by 2. So if she jumps back in, and then we also had a couple people from Watonwan County who had registered who said they were going to join us. So if they jump on, Naomi and Julia were talking about joining us as well. So maybe they got caught in some of the snow down there. Hopefully not. So, okay. I also wanted to let you know a couple other people who were interested but not able to join the meeting, just to pass along some of this. So let me just pull up her. It's, are you all familiar with Sue Larson? She's with the Children's Museum of Southern Minnesota.
I'm familiar with her.
Okay. All right. So Sue was not able to join the meeting today. So I know that they are doing some work through the Children's Museum, that some resources they wanted to offer up and share with each of you who are considering putting forward proposals. So I will put a reminder for myself to share the Children's Museum resources. And then I also am going to, when we're done, share some resources that will help with professional development and training around reflective practice. We've been, a couple organizations have reached out to us to ask us to share information. So, okay, I'm gonna go back to the slides here. So I had forwarded each of you a copy of the proposal. So I'm going to reference that. And then I'm also going to reference the materials from 0 to 3. So they have a planning guide that I just wanted to make sure we highlight along the way as well. So what I'm going to do is just talk you through some of the information about the proposal, make sure people have questions, that we can try to answer their questions as best as possible. I'm assuming all 3 of you are considering applying for the resources, and that's why you're on the webinar. Is that correct?
Yeah, well, at least for the YWCA, I know we've discussed some different options.
Okay, and then do you want to, Erin, talk about what options you're exploring then?
Well, I just had a conversation last week with Marie Lynn, so I'm not completely in the loop of what's going on, and she wasn't able to be here today, so I said that I'd fill in.
Okay.
But, you know, we're looking to kind of, you know, we've definitely expanded our services over the last couple of years.
Yep.
To include different populations, but also kind of into, you know, different geographical areas. And, you know, we want to make sure what we're doing is effective. And we're looking into kind of some different avenues of that.
Okay, great, great. All right, and Mary, are you looking at doing a startup of one of the evidence-based programs or a planning grant?
We are looking at joining actually Shara's group. We are looking at applying as a regional project with Faribault Martin, Brown Nicollet, Watonwan, and LeSueur-Waseca counties.
Ah,
So,
there you go.
yeah.
Okay, nice. And so would you, together with your regional application, so should I assume then that Shara, the application will come in through Faribault Martin and you'll be expanding to include the other regions? Is that what your proposal would be? Okay.
Correct.
All right. And then will everyone use the HFA, or will you also start up another option?
Nope, everyone will use HFA.
Okay. So it will be Nicollet, Brown, Watonwan, LeSueur, as well as your current, you know, Faribault Martin counties.
Yep, and Waseca.
Oh, and Waseca. I missed that one. Sorry, Mary, you said that and I missed it. Okay. Okay. Wow. Great. That's exciting. Okay. All right. So we'll talk about expansion and startup. And then we're also going to talk about planning because Erin, I know Marie Lynn had asked about the options and what was available, and a planning grant might make sense for the YW rather than a startup. So, but we'll talk through that. Okay, so the request for proposal, everybody knows that it got extended until February 1st, which is good news. So I have a little bit more time to figure all these things out. So the new application date is February 1st, and the grants will be made beginning May 1st. The proposal, the grants as they are written, if you are looking to implement or start up a home visiting program, the grant would be May 1st, 2018 through June of 2022. So it's a little bit more than a 4-year grant, which gives you a nice amount of time to begin to show some outcomes for the services that you've identified in your proposal. If you are applying for a planning grant, then the timeline is May 1st, 2018 through June of 2019. So it's a 14-month planning grant. What I want to be clear about with the planning grants is you have 14 months to actually make a plan and identify which of the evidence-based models that you would begin to implement in the next round of funding. So if you are pursuing a planning grant, and based on what I know about what's going on in the Mankato area and the work that you've been doing, Erin, with the YWCA, a planning grant might be a good option as you begin to figure out which evidence-based model makes sense, because you're working predominantly with newly arriving families, both immigrants and refugees. So you may want to figure out which of these evidence-based models is going to be culturally appropriate. So that would be one of the things that I had mentioned, Marie Lynn, is that based on how diverse the communities are in which you're serving, it may be in your best interest to begin to explore which are most culturally appropriate and which you might consider. If you go after a planning grant, it is solely planning, and you would still talk about how you would partner with other providers and or resources in the community, but you would not use any of the resources to implement the model. So it would give you a full 14 months to plan it out, to begin conversation with each of the models that you want to explore. It would also give you access to staff at the Department of Health who could help you plan out some of these things, and then position you for the next round of funding that is available. And you may or may not recall when we secured resources from the state for home visiting, they awarded $12 million for the first biennium, so $6 million a year. $6 million a year in fiscal year 18 and 19. So a little bit more than half of that went out in the first phase of the evidence-based home visiting grant funds. Phase 2, we have $3.2 million, which isn't a ton of money to work with in a 4-year grant period. So a planning grant might be a good option if you're not positive which model you're going to use. When the additional resources are released in July of 2019, which is fiscal year 2020, then those of you who receive planning grants are well positioned to apply for an implementation grant with the next round of funding. And because of how the department is granting out, is making these grants available, there will be an additional $10 million that will be coming forward in fiscal year 2020, which is July of 2019. So that would be important for everybody to know, regardless of what grant you're going for, because really $3.2 million is not a lot of money so, to serve this many families. So, questions at all about the planning grant? Or about the timelines that I had stated? Okay, if you are, I'm going to just go on a little bit more, and then this is also relevant for the startup and expansion grants here as well. I sent you the tool, the 0 to 3 planning tool. This is a resource that was made available to states when the MCTHV funding, the federal funding for home visiting, was first made available. In Minnesota, Erin, you might be the only one who doesn't know, but in Minnesota, when the MCTHV funds were made available, it was for local public health agencies and tribal health agencies. Nonprofits weren't eligible in Minnesota to receive these funds. But regardless, this tool is a great resource for all of you to be looking at and considering when applying for these funds. So, and the Department of Health knows that we're promoting these materials too. So, you know, if you can think about using this to help organize your applications. So in this tool, if you look at the 0 to 3 tool on page 4 and 5, it encourages you to identify what your needs are, your demographic information. And then for those of you who aren't, well, so Erin, since the YWCA is not a public agency, what I encourage the Y to do is to work with Blue Earth County Public Health Department to make sure your statistics and data is consistent. What we would want to avoid is having an application come in from one nonprofit and then a local public health that has really different data. So I just encourage you to be partnering with them. Even if they're not going to implement it, you would still want to partner with them on those resources. And then this tool actually walks you through different things for you to consider when putting together a planning grant. For both of you, and I'll circle back to the startup and expansion as well, but regardless of your grants, everybody is being asked to identify what existing home services are in your community. And on page 6 of this, you'll see there is a document. It asks you to name all the different home visiting services in your community. Through the coalition, we were really encouraging the Department of Health to begin to promote and provide incentives for local communities and regional communities to collaborate. And what we want to be able to better understand is how both our public system and our nonprofit system are working together to best serve families in our communities. So we encourage you to fill this out with your partners. So even with your regional expansion application, if you can begin to identify, Shara and Mary, who else is working on home visiting in your region. So think about including your early Head Starts and the ECFV, because many times they are providing home visiting services, but you want to make sure they're included in this. And if anyone is running a PSOP program through Human Services, that would be helpful to include that. And Erin, those would be the same types of partners that the YW would want to include beyond Blue Earth County in their application. And in fact, the United Way Agency, the Greater Mankato Area United Way Agency, has their Success by 6, so they have several people that you could identify as potential partners. And then let me just list this other piece here, because you'll want to, if you want to explore it. The Children's Museum of Southern Minnesota is, and many of you may know this already, this is located in Mankato, so depending on how close you are to the Mankato area, but they actually provide membership opportunities for home visitors to access for free, so they can actually bring families or encourage families to use the Children's Museum in Mankato. And so Sue Larson is the contact person. It's called the Gateway to Play membership. So if you're not familiar with it, you can take a look at it, but it's a nice community resource that you might want to think about either sharing with your existing home visitors or offer it, think about including it as a partnership in your application. But she wanted to make sure folks were aware that that was an opportunity. Okay, questions about the planning grant at all and what's required?
I don't have any questions, but I did want to let you know that Amy's having internet issues and hasn't been able to reconnect.
Oh, okay.
So
she could call in using that number.
And yeah, maybe I'll let her know that.
Yeah, if she wants to. I know she only has the last half hour. and we just went through the majority of the planning grant, but I'm happy to fill her in regardless.
Well, and you're recording this, correct?
Yep,
Okay.
we're recording it.
All right.
Okay. All right. Well, let's talk about it. Yeah. So if you, Erin, if you want to let her know she can join us, that'd be great. Let's talk a little bit about the startup and expansion grants. Since Sharon and Mary, you all know exactly what model you're going to be using in your expansion grant, correct? You're all using the HFA to expand.
Correct.
Okay. All right. So here are some things that we've been encouraged to let potential grantees think about when they're putting forward their application, especially if you've been partnering with the Department of Health as you have in receiving resources. So what we are encouraging applicants to consider when applying is to be sure to identify how many new families you will serve with this expansion. So because there is language in the legislation and it shows up in the RFP about not supplanting funds, you really want to be able to talk about how you are serving additional families with these new resources. And then because it's so competitive, this process, instead of being released on a formula, they are expecting people to show outcomes related to the expansion. So that's one of the things that we've been encouraged to remind people about, is being really clear in your work plan and in your narrative and then in your budget how you're reaching additional people with the resources that you have or through this grant. So that'll be something that you'll all want to work together on in the number of families that you serve. The other thing, one of the advantages of working in a regional collaborative such as this is how you think about staffing these positions to reach additional families and working collaboratively to do that. What we have heard from other communities across the state is that they're looking at having shared supervisory roles potentially. So that's something for you to consider if you haven't already been thinking about that you can have somebody who's trained in reflective supervision who could work across the region with home visitors. So that would help in reaching some of the requirements that are necessary for the HFA model that you're looking at, because I know they have requirements around reflective supervision. So that would be some of the advantages for you to be thinking about and leveraging each other. And again, in this 0 to 3 resource tool, they talk, there's a number of different things for you to be looking at in regards to hiring and training and recruitment. So beginning on page 10 through 12, I believe it is, they have a number of different questions for you to be looking at around training and helping you think through what it's going to cost to do all of that. What we wanted to be clear also is that you have the ability to add your training costs into your proposal. So any costs that you have in meeting the requirements of the model, especially around reflective supervision, something that you can then include in your budget. So they wanted to be clear about that as a resource. And then there's just a number of great questions that the 0 to 3 planning document helps you potentially think through when working together to put your budget. Questions about any of these items thus far? No? Okay. I wanted to, I'm quickly trying to find this document here while we're on this together. Another organization wanted to share resources with people, so let me grab it here if I can. This is yesterday. Okay, well, I'll grab it while we're talking. I don't want to slow us down. Oh, here we go. So I will forward off to you, I can forward additional information to you from the Children's Mental Health in Infant and Early Childhood Division, MACMA. They do a lot of training with reflective supervision, and they have a partnership with the University of Minnesota to train on the different levels of reflective supervision. So there's some new resources coming in externally that I will forward you the materials so you can take a look as well. Are you familiar with their organization, either of you?
I'm not.
Nope.
Okay. Where are you currently going, and how are you currently getting the training around reflective supervision?
I'd have to ask our supervisor where we did some work. She did go to some, I think there were some things going on in the cities that were advertised through Department of Health, so she did that. But most of our reflective supervision we have in-house because we are human services, so we have mental health clinical supervisor who has a specialty in children's mental health. So we are able to use her for reflective practice and to help with reflective supervision with our supervisor.
Wonderful.
Mm-hmm.
And will you tap into her skill set then for all of through the expansion, or are you looking to hire additional people?
We would probably not be able to do that beyond our agency because of the scope of size and geography.
Mm-hmm.
But you know, we have not met. We were supposed to meet today, but weather has prevented that meeting from happening. So we have not met yet to have those initial conversations about reflective practice and what we want to look like. But we are thinking about a program manager coordinator position to ensure that all of the counties are practicing using model fidelity to help with data. So I could definitely see that person having a function of having some training with reflective supervision and being that centralized person across. But I do envision that every county would want to train their supervisors in reflective practice as well, so that it's embedded within and it's sustained when you do that versus having a grant funded position that could go away. So
Right, exactly. Okay, all right, great. And then Mary, are you, as because this would be essentially a startup for you within your county, and probably some of the others, right? So is it the first time that Watonwan, Le Sueur, and Waseca would all be offering an evidence-based model too? Right? Everyone else is doing evidence-informed models, right?
Yes. I guess Shara answered the best answer. I would just say that we haven't even met, so we haven't even worked out any of these details. My MCH nurses or family home visiting nurses went to reflective practice training with the Brown County maternal child health nurses a couple years ago. So they have that background, but we have all those questions to answer yet.
Okay, got it. All right. Yeah, those will be helpful in thinking about the application. This is, as you know, you've all done these applications with the department before, and this is a pretty intense application to complete. There are tons of different details that they want people to respond to as you go forward. So, okay. The one, oh, I'm sorry. Did somebody else join us, or was that somebody's computer?
that's just my computer.
Okay, okay. So the other thing I wanted to point out in the 0 to 3 document that will be really useful to you or that may be useful to you as you are planning your applications. The RFP does ask you to talk about and highlight your collaborations. So clearly with this regional application that you're talking about through local public health, you're collaborating with local public health across the region. And then if you can speak to how you are partnering with other public agencies or nonprofit agencies, that will be important. I do know through the coalition, as I mentioned, we really are trying to advocate as much as possible that we get cross-sector collaboration. So I think they are looking for that. I think people are aware of the importance of that. And you may or may not know, the legislative auditor is putting together a report currently that will look at all the different early childhood systems and how they are supporting families. That should be released in February, and people are and home visiting services are part of that report. So people are anticipating that we might get called to task around improving our collaboration efforts across systems. So I think it's a nice proactive way, again, whether it's your nonprofit agency providing submitting an application, or a public agency submitting an application. The more explicit we can be around coordination and collaboration, the better positioned we will be as a field in responding to the legislative auditor. But there are, in the 0 to 3 document that I gave you, there are some good tools here to think about collaboration and coordination with other agencies. So you can take a look at that. And similarly, it gives you some suggestions on considerations for public engagement with the families that you serve. So one of my questions to each of you is, how are you currently engaging parents and community members and getting feedback on your home visiting services that you're currently providing? Are you all doing that at some level?
I can answer that. This is Shara.
Yeah.
We have a family home visiting advisory committee that meets quarterly. And it includes multiple early childhood providers across our 2 counties. So we've got some early childhood special ed involvement. We've got, we don't have Head Start, but we have Early Childhood Initiative, which they're part of. We have medical community. We have youth organizations. We have some parents of the program, so some current recipients involved as well. So it's a pretty robust group in terms of who we're reaching out to.
That's great.
And then we also are very active with our Early Childhood Initiative, and so we are able to, we're actually working on figuring out how we can improve the referral system between programs. And we just learned that our Head Start is also using Growing Great Kids. And so we've been able to, once we get signed releases, have conversations with that Head Start home visitor about what we're using with that same family. If they happen to be in there because of a 3-year-old and we're in there because of a baby, we're able to better collaborate and partner so that we don't duplicate and we can build off of each other, versus both of us doing our own thing and nobody really talking to each other about what's happening. So nice. We've had some really good luck since we really got started in January of this year, doing some really good collaboration. We also have some good collaboration with Help Me Grow, and we're working on better collaboration and referral from our providers, but that's our weakness right now is our medical providers. They want to, they just don't. With Mayo, they don't have the system developed to really do good referrals to us. So right now we're using our WIC program as our entry point for home visiting.
Okay. Great. Okay. And Mary, what are you all doing? Do you currently have an advisory council, or are you engaged with your early childhood initiative either through the initiative foundations or through United Way agencies or local collaborations?
One of our nurses has been attending Success by 6,
Oh, sure.
and I know that they meet with regional partners, but I believe both of my nurses are signed up to attend the January meeting that you're holding.
Oh, great.
And they are looking forward to more collaboration, because I think that's been a little lacking in our area.
Okay.
When I went to your meeting, it was very interesting to find out. We had just done a little outreach to all of the partners that were there, but it was very interesting to hear all of the visiting that was going on in our area.
Right.
I think the area that's probably the least, well, it's not really lacking, because I don't think there's a big problem out there, is our West County, our greater county area, our rural areas. So
Okay.
right now we're doing, we're just reaching out and trying to participate in that
Okay.
group. So,
And
and
so
I know that my nurses are part of, like, IEICs and all kinds of things, and I just am not as well versed in all of that. So
yeah. So I would
we have,
encourage you, as you think about your application together, it's how you can, talk about those collaborations that exist and even building
Yeah.
upon those.
yeah.
Locally. Yeah. Yeah. That's great.
We also have a little trouble with the referral from the providers, with the referrals, lack of a provider referral system, maybe is the word. In Brown County, they have a LINA, and their docs refer everybody, every prenatal, every postnatal, to public health. And we have the situation where Mankato is where our major hospital for deliveries is.
Mhm.
And because there are so many different counties with so many different programs, they kind of tend to not refer too well to anybody. So there is a First Steps program that was formulated with the United Way funds in Blue Earth County, and so that program really does a lot of the coordinating of some of the referrals, and has a family visiting program too. So
Okay.
referrals are an issue.
Yeah. No, and it's not unique to your area. So we were just talking about that in St. Louis County, Cook, Carlton. Yeah, it's not unique. And it happens, in the metropolitan area as well, where there's a lot of services. So, okay, great. Erin, how about you? Does the YWCA have an advisory council that it uses, or does it use its board of directors to help you think through these things?
I can only speak to the little portions that I know from the history of working with the YW and stuff, but I know that we're part of the First Steps Collaborative. That's how we initially got our start, was through United Way. And we partner with a lot of other nonprofits in the area and try and work with the counties and things like that. I know that at one point we had kind of like an advisory board for Ready to Learn in place, but they weren't exactly sure of kind of what their place was within the program. And so I think some of those things are still kind of under development, and I think with Marie Lynn in there now, they'll be more focused for some of that kind of oversight stuff. But I don't know exactly what committees and things like that she's a part of. We were part of the initial Children's Museum with getting that Gateway membership program started and stuff like that. So, and whether or not they're still meeting, I'm not sure.
Yeah, I know Sue wanted to make sure people knew about it, and I don't know how many people are meeting, but Elizabeth Harstead is planning to continue to try to get people back together. Sounds like those meetings, and Mary, you were just talking about those, have stopped for a short while. So people are interested in getting folks organized again. So,
Right. Okay.
yeah.
So I guess that's what I know from history wise as to what's exactly being done at this moment. I'm not exactly sure.
Okay, great. All right. Questions at all then? I'll leave it here. Questions at all about the expansion grant startup or planning? Like are there things in the RFP that came up that you have questions about specifically that you want to try to run by each other? And that's okay. I'm gonna share with you a few things then. If something comes up, let me know. What I do want to encourage you to think about when you fill out the proposals, because these are pretty significant proposals, is we want to make sure that you are as clear and concise as possible. And a piece of feedback that I heard that I think is important to pass on is oftentimes when people write proposals, they talk around a question and don't answer a question directly. So I have been encouraged to really promote the idea of being as clear as possible and answer the specific question that's in front of you in the proposal. So if you or yourself are not writing the proposal but have a grant writer, what we've been encouraged to even help promote is the idea of literally in each section of the proposal, they have a whole set of questions, is to highlight the question and then just write the answer underneath it. Highlight the question, write the answer underneath it. It might not feel incredibly coherent and cohesive, but you can start to show that bigger picture of what you're doing in your work plan. But to use the narrative to really address each and every single one of those questions would be really helpful. The other thing that the department wants people to consider, or as you're writing your proposals, is rather than referring people back to a different section of the proposal, is just, again, restate it as stated on this page, blah, 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 blah. But so restate what you're being asked to provide information about, or make a specific statement of where you can find something in the in your work plan or on your budget. So be as specific as possible in helping people find information about your program and how you're working together. So I know it sounds really basic, but unfortunately, many times, because there's so many things that they want you to cover, sometimes people get lost or distracted when writing the proposal. And I know it's important to tell the story, but they're a little bit less worried about the story and want the answers to all those questions. And I think your story will start to show up in your work plan. Does that make sense? What we're encouraging people to do? Yeah, okay. All right, great. All right, then I wanted to just share some of these other resources. So if you, for those of you who are not on the webinar, who are just calling in, there's, I'm just wanting to share where we have on our website the webinar that we conducted with the 6 different evidence-based home visiting models that are being prioritized in this RFP. So on December 11th, we had all 6 programs represented on a webinar, and then we have all of their slides, and we have a whole group of resources that they each provided us for you to take a look at when starting up or implementing a program. So I think, Mary, for you specifically, as you work with Shara and your other colleagues, if you want to take a look at the HFA folder there, they did give some really good startup information that you can access and figure that you can ask them specific questions. Obviously, you're going to work closely with Shara, but it will help you figure out within your own agency what are some of those implications. And then, Shara, they're also a resource for you as you think as the lead agency. How do you think about making space for each individual organization, but then expanding services across? So I do think that they'll be a really helpful resource when you are doing your grant. Each of them have made a commitment to working with people, so please don't hesitate to reach out. Are you currently working with Kathy, or are you working with Amy, either one of them at HFA?
We work with Christy Peoples.
Oh,
She's
okay.
been assigned to us. So, and I did send her, because we are affiliated with, we have planned our site visit for HFA for August of 2019. And so I did let her know that there's this RFP and that we are exploring expanding our service area and geography. So they are more than happy to work with us on that. And we may be able to bump our site visit out a little bit more because we are bringing on some new partners.
Okay, great. Christy was one of the people listed as a resource person, but it was Kathy and Amy who were with us on the webinar. So I think they have obviously her contact information. So I don't know if it makes sense, if Mary, if you want to reach out to Christy instead of either Kathy or Amy, but somehow we just want to make sure that they know who your contact people are in the region. So.
Okay, thank you.
Yeah, to make sure you take a look at those resources, because I think it will be helpful for each one of the local public health departments to for the considerations within the organization. And then, Erin, I wanted to make sure you had an opportunity to go and visit or work with Marie Lynn and Amy on the other evidence-based programs. So from what I know about the work at the YWCA, the Ready to Learn program, I would suggest that you start taking a look at either Parents as Teachers or Family Spirit. Parents as Teachers is going to give you the greatest amount of flexibility for who you've been serving, because many of the families in Ready to Learn have multiple children or older children, and Parents as Teachers allows you to work with families with multiple children and not just the new baby. So it does give you some additional flexibility as families are arriving into the U.S. And helping you work with the entire family system, the older kids as well. The other one for you to encourage the YW and for you all to look at might be the Family Spirit program. It was originally developed to target the Native American community, comes out of Johns Hopkins. However, what we heard during the webinar last week is that they have 2 different communities in the U.S. now who have adapted this model to other communities other than the Native American community. So within the African American community, and it might, and I don't remember the other one. So I do know that they made the adaptation though. The Family Spirit model, why I think it might be a nice fit for what the YWCA is doing is it does a lot of risk reduction work and focus. So for families who have experienced a lot of trauma from living in a refugee camp and then trying to resettle, it helps you really focus on diminishing these different risk factors and helping them then adjust or acclimate to the new community. So it might be an opportunity for you to explore that. The others are phenomenal programs as well. They are really focused on 0 to 3. And so it would then require that the YWCA continue on its evidence-informed program along with an evidence-based program. And that's always an option too, is for you to look at doing both, have an evidence-based program as well as the evidence-informed program. So.
Okay. Thank you. I think that'll be really helpful to look into those.
Yeah, I would strongly suggest, based on what I know from, I worked with Kelly before she left, so what she had shared with me, and then Marie Lynn, I think the Parents as Teachers and Family Spirit are probably most appropriate for what you're currently doing.
Okay.
And then the other thing to really encourage you, because you've been working with families beyond the Mankato area, is a collaboration with Blue Earth County. And then are you in any of the other counties?
We're in Nicollet County.
Okay.
And I think that's it for right now. As far as I know, sometimes occasionally there's a family that gets referred that might be right outside of Blue Earth or Nicollet, and we still would serve them.
Okay. Well, and if you haven't already begun the conversations, obviously, with Mary, who's here today. So if you want to spend any time even talking through what that might look like, if now that you know, and that would be important information to bring back to Marie Lynn and Amy as well, that Nicollet County is now looking to start the HFA model, which will target 0 to 3 families with young children. Maybe there's a way to look at a model that would allow you some additional flexibility so that you're not duplicating.
Right. Okay. Yeah, Mary, we'll have to get you in contact with Marie Lynn and Amy, and then you guys can kind of set up a time to meet and go from there.
Okay. Questions about any of these other models or the resources that we put available on our website? No? Okay. All right. I do want to also restate. So on our website, not only do we have the materials from the different evidence-based programs that are being prioritized in this model, we also have a number of different training resources that you can look to or utilize and even identify in your proposal if you want. Take a look at what is there. They want to, in the proposal, you're asked to identify what training will be made available and how you'll do that. So all of those resources are free. So we encourage you to tap into that if it's helpful, and then be mindful of how you can, collaborate and coordinate the training that is required for HFA. I will say at some of the other meetings that we had earlier this week, there was a question around whether or not the Department of Health will continue to support the fidelity of the HFA model. I don't know, Shara, have you been tapping into their resources at the health department on the HFA model?
The only thing we've really utilized has been the trainings that they were providing, but we know that those are going to be going away, and it'll be up to the grantees to determine how to move forward.
Yep.
And then we have a family home visiting nurse consultant who we've been working with, whose specialty is HFA. So she's a resource for us that we utilize, and she's assigned to our region.
Oh, good. Okay. Who is it? Which one?
Sylvia Cook.
Okay, nice. All right. So one of the things, just so you all know, is the coalition has been asked to consider how we might help support the delivery of evidence-based models. So it is something that we will talk with our collaborators and partners about. So if you think it's helpful to have another statewide resource that's helping coordinate and ensure training is made available from time to time, we would love to hear from people. Our whole goal is to make your job at work easier and really help build this field. we think it's incredibly important that people are ready for this proposal and these funding opportunities, and even more so by 2019. We know that the need is out there, and we intend to go after additional resources, but we need to make sure we are spending these resources and delivering high quality programs to families. So if you think it's helpful to have a place where training is supported, professional development is supported, shoot me an email, let me know if the conversation would be useful, and then we can begin the exploration of how we would, finance it and how we would make it possible. We assume there will be some economies of scale as more and more people are introducing these evidence-based programs across the state. So we are committed to making sure people are successful. So Shara, you are nodding your head. So it's something that you thought would be useful if we could have that conversation at some point.
Yeah, I think what we're dealing with right now is we just hired a new home visitor who will start with us in January. And with the Healthy Families program, you only have 6 months for them to get the core training that they need to, in order for us to be able to successfully move through accreditation. So what we're running into right now is we either have to send this person out state, Omaha, wherever they are holding these regionally by HFA standards. Their region is a bunch of states. And so it would be really advantageous for a group in Minnesota to identify and make a commitment to offering at least 2 trainings per program per year. I think another issue is the size limit to how many people you can train.
Yes.
Yes. So, that becomes a little bit complicated too. And I think you're going to have an influx when people get funded with this RFP, and we'll probably have quite a bit of training available. Now, with the moving the grant, pushing it out to May instead of, the timeline getting bumped is good for us right now. But in terms of me hiring a new nurse, are we going to be able to set up training and get our new staff trained? She would have to be trained by July. That's not a lot of time. So that's something I've talked to with Sylvia as well, just to say, if you are hearing of other people in Minnesota that are needing to train staff in HFA, we should be connecting, because if we can get enough people, then we will have enough to bring a trainer here and not send our staff out of state to become trained in these programs. So I definitely feel it's a need. Yeah. We just need to figure, somebody has to be that catalyst, and it is going to be a little disappointing if MDH is stepping away from that when they're the ones pushing these evidence-based models. So that's kind of my viewpoint on that.
Yeah. So Mary, is it something that you would then tap into also if the coalition was able to help organize some of these trainings?
Yes.
Okay.
And we've been working with all of the counties in southeast Minnesota as well. There's actually 15 counties that have been meeting pretty regularly to discuss home visiting and then looking at this RFP. So we've broken off into 2 different groups of people who will be applying. There's a southeast group and a south central group. And I know that this conversation has been had in that group, and all the counties in southeast would also take advantage of that. And that was actually part of our consideration when looking at applying, even as all 15 of us together. We realized financially we wouldn't be able to do that, or it wouldn't be manageable. But just the ability to share in the training and, having that availability will be really helpful for keeping our programs going.
Okay. So it was the southeast group and then south central group?
Yes.
Right. And then are all of you thinking about it as broadly as you 2 have talked about it here, where you're talking both public health, other public agencies, and then nonprofits that you are aware of?
Yeah, I would say, we're probably looking more at the nonprofits as a partner versus, for more of like referral either to or from the program.
Okay.
more so than actually delivering the program. And I know that's a little bit different in Southern Minnesota because we don't have a lot of nonprofits that are doing home visiting services directly, and especially those that are using a model like HFA. Whereas in the metro, I think that's a different story. You have a lot more nonprofit that are implementing or are able to use a Healthy Families America program. So there would be more opportunity for kind of a service delivery shared partnership, whereas we're looking more at a referral type partnership.
Okay.
And one question I had for you too, Laura. I just perused MDH's website again, and I know they had said they were going to be releasing a list of all of the people who had submitted a letter of intent.
Yeah.
But there's nothing posted on there. And I think, as we are creeping into January, it would be helpful to get a copy of that.
Yep. I'll do a link.
Yeah. Oh, there is one out there then?
There is. Yeah. I'll just look it up and send it to you after the meeting.
Okay, perfect. That would be
available, and it might be on the Tuesday topics, but I'll send it to everybody. So Erin and Mary, you will have it too. But yeah, it would be extremely helpful. I think what I've heard from others, like when I was up in Duluth earlier this week, they were actually surprised who was actually applying or who thought they would be applying. So it's a great way for people to kind of hear who else in the community is interested, at least. And then the other piece was that you did not have to submit a letter of intent to apply. So Erin, I don't know if the YW did submit, I can go back to the list, a letter of intent, but regardless, you can still apply.
Okay, that's good to know, because as far as I know, we didn't, but they might have submitted one.
Right. So it does not, it was encouraged, but it was not required. So, and then the other thing for you to think about, just as Shara and Mary were talking about shared training, the parents as teachers is also, there are a fair number actually of nonprofits who are looking at that model. And I think in part because what we've seen is that a lot of the nonprofits who are providing home visiting services are working with families who have multiple children, because local public health had tended to target that 0 to 3 and have a pretty good coverage. And then we're seeing families who have an increased need or some trauma or some event going on in their life when the second child arrives, there's this need that's out there. And so some of the models, evidence-based models aren't available to those families. So many times nonprofits will step in and start to either do an evidence-informed program or meet the need some other way. So Parents as Teachers is one of the more flexible programs that are out there. And so there are a fair number of nonprofits who are looking at implementing that, and that we could then look at doing something similar if there's enough people interested in doing that type of training, we could help bring in training around other models. So it just kind of depends on what people are interested in, and how we would just need to do some work. We have a little bit of time between now and when or January and when the grants are released in May. So we can do some thinking around that together. Okay. So take a look at the website. The Department of Health has information there. I will let you know also, at some of the earlier meetings this week, we had a couple questions that people raised that I did not have the answer to. And so while the question and answer period is complete at the Department of Health, I'm still going to submit them and ask them to respond. So if there are questions that you have about the RFP, and you want to raise them now, I will add them to this list of questions. I'm just going to submit the list of questions to the department and then let them know who all attended and ask them to consider adding it to their Q&A document that they've already released. And I'm hopeful that they will provide additional responses to these questions simply because the coalition had asked them to partner with us. They just thought we could do more without them. Like we could say more than they could. If they were in the room, they might not be able to say as much. So that's why we decided to move forward without them here with us. But so anyway, we will try to get all those questions answered as well. So were there other questions that you thought of that you wanted to make sure we had responses to? Nope.
I don't have any questions right now.
Okay.
I don't either.
All right.
Nope.
Well, that sounds good. So what we had built into the other meeting time is now to spend discussion time around what people were doing, what kinds of collaborations you might need to consider further. So we can spend some time here doing that. But it sounds like at the regional level, you have something set up for the South Central counties to meet. You're going to reschedule that meeting. If anything comes out of that meeting that you want us to know from the statewide coalition, that would be helpful in trying to secure information from the department in the process, let me know. I'm available as a resource. And I can, you know, the worst they can do is say no to all of us asking. So, but it doesn't hurt to ask. It's what I found in Minnesota. So let me know if we can be useful at all. But do you want to spend any time talking through or anything here, or would you like to end early?
I need to end early.
Perfect. All right.
And I'm not sure that it makes sense for me just to hang on. So, you know, and we're missing a good chunk of our cohort. So there really isn't a lot we can talk about until they're all together.
Right, right. So we're, Naomi and Julia, they were going to be on the webinar too, but they're part of your application, right?
Yes, and I'm actually the CHS administrator for Watonwan County right now. So
Okay.
I work with Julia really closely. She actually messaged me. She wasn't able to get on the Zoom. It wasn't working for her. So
sorry.
It was about 2 o'clock, and I'm like, I don't think it's probably worth your time to jump on now. So, but yeah, they're very, you know, involved, and I'm sure if there's a recording of this, she would like to watch it.
Oh, perfect. Okay. All right. That sounds good. Okay. So, so Mary and Shara, thank you so much for joining us. Good luck putting together that application. That'll be a fun application to submit. I meant that really sarcastically. So,
Thank you, Laura.
yes. No, it'll be great to work together. So good luck to you all. And let me know if there's any questions that that come up, if I can be helpful. Okay.
Great. Thank you.
Yeah,
Thank you, Laura. This is very helpful.
Yep. Thank you. Oh yeah. And I sent you an eval. If you can send that back to me, please do. It's 4 questions, just 4. So, okay. And then Erin, did you want to add, do you have any other last questions that you'd like to go through then?
I don't think so right now. I think it'll be important for Amy and Marie Lynn to watch this, and then they might have some questions.
Okay.
And so I'm guessing after the holidays, you know, they'll probably get around to viewing it. So
that sounds good. And I did say to Marie Lynn, again, what I know about the YWCA, you might actually be in a really good position for a planning grant. You've done a lot of work, but it would give you 14 months to figure out, again, which one of these is most culturally appropriate, because you work with really diverse communities. And then it would give you as a nonprofit some time to get your board ready to support this kind of work too. So.
Yeah, I agree. You know, it's going to be important, I think, to really kind of test out what's going to work for our population and for our organization, and how to make sure that it's going to be sustainable in the long term. So,
right. And you might find that, you know, with that planning time, then you could, you know, spend time thinking through if there are families that you're working with that you wouldn't be able to serve with a specific model. How could you keep, how could you keep elements of the Ready to Learn program still operating and functioning that would then align or coordinate with a model program such as, the Parents as Teachers and or Family Spirit, something like that. So
Right.
thinking through, like, not giving up services to families, but
Right.
really trying to target outcomes and program improvement as much as possible for eligible families, and then bring those learnings to your evidence-informed program.
Okay. Yeah.
Yeah.
I think, yeah, that'll be really important to ensure that services are not being removed from families when they really need them. So,
Right, and there are ways to do that, and just having
Mhm.
some time to plan. And the planning grant gives you opportunity to work both with that model or models as you're figuring it out, other community partners, and then you would have access to probably Sylvia at the health department. So I assume, but I'm not positive who it would be. So it would probably,
Right.
could be the program manager, Don Reckinger, or Meredith. It might be one of them, or it would be someone local. But
Okay.
regardless, it would be nice to have additional support that understands the region.
Right. Yeah, I agree. Definitely.
Okay. All right. Well, thank you
Thank
so
you so
much
much. It
for
was very
joining us.
helpful.
Yeah. So I wish you a nice holiday season, and then we'll wait to hear back from Amy and Marie Lynn.
Sounds great. Thank
Okay.
you.
Thank you.
Bye.
Bye-bye. Stop share.